And thank you all for coming today. So I'll just in the interest, we'll just get started. So yes, we are speaking to the health service delivery research priorities for individuals with complex care needs in New Brunswick. So we'd like to first acknowledge and thank our research team. The principal investigators for this study were Dr. Shelley Doucette and Dr. Allison Luke, who are also at the Center for Research and Integrated Care. And we did get funding for this study from the CIHR Catalyst Grant in patient-oriented research. So a bit of background, health research in Canada is progressively moving towards engaging patients in health research and their caregivers, where they can positively contribute to the improvement of healthcare systems and practices by sharing their experiences, which we call patient-oriented research. So one level of patient-oriented research is priority setting, where patients and caregivers identify areas of concern in the healthcare system or within their disease or condition that they'd like to see changed or researched or answered. And one subset of patients who are in a unique position to offer these perspectives in New Brunswick on healthcare service gaps is those living with complex care needs. These individuals tend to account for a disproportionately high health service usage relative to their population size. And this is just due to the unique complexities of healthcare that they need. So complex care needs can encompass a combination of medical, social, behavioral factors that can result in increased medical, social, and educational support needed for the individual as well as their caregivers. Often individuals with complex care needs have multiple chronic physical or mental or mental health conditions and require multi-provider care across a wide range of settings and sectors. Children and youth with complex care needs, as well as older adults in functional decline, represent two populations presenting with complex care needs. And due to our interest in understanding the health service gaps in New Brunswick, we set to explore the health service delivery research priorities for these two populations. So just a bit more on children and youth with complex care needs. So this is increasing in Canada with nearly 1% of children and youth living with complex care needs. Over the course of 1 year, these children and youth are predicted to visit 4 times more, or specialists 4 times more than children with one single condition, and use 5 or more prescription drugs. And as well, hospital care costs for children and youth with complex care needs account for about 50% of costs for all children and youth. And they account for about 37% of hospital admissions. 3% of children and youth with complex care needs in Canada are hospitalized outside of their home province. And notably, New Brunswick does not have a pediatric hospital, and most children or youth requiring any tertiary or specialized care in the province will usually be referred to the IWK in Halifax or Montreal Children's Hospital. So these patients and families can also tend to experience a high number of care transitions over their lifespan, leaving them really vulnerable for those discontinuity or gaps in their care. Children and youth with complex care needs depend heavily on those informal and unpaid caregivers, usually by family members, where on average, they're receiving 44 hours per week of informal care. And these caregivers can often express or feel feelings of anger, distress, depression, and really have a hard time continuing on with this role. Similarly, for older adults, this is also increasing, where 37% of older adults are managing 2 or more chronic conditions. So the interaction of these complex conditions can lead to psychosocial needs and make the assessment, planning, and delivery of health and social care just more complex overall for this population. Although many individuals living with these complex needs can maintain a high level of functioning, the consequences can be significant as they can affect their activities of daily living, reduce their quality of life, and increase mortality risk. On top of this, older adults with complex care needs often use multiple medications, which can increase the risk of adverse drug events and inappropriate drug use, where some of these drugs actually have safer alternatives. So older adults with complex care needs also account for a higher level of healthcare spending, with over 50% of even the New Brunswick public drug program spent on individuals over 65. So again, we can't forget about the individuals that are providing care for this population. And just a few numbers again, is approximately 1 in 4 Canadians and 1 in 4 seniors are informal caregivers to this population. So given the numbers and often highly demanding responsibilities that they're shouldering, caregivers are prone to stress and burnout, which can negatively impact care provision. Over 95% of individuals receiving long-term home care have an unpaid caregiver as well. And these caregivers are also feeling distress, anger, depression, and having a hard time continuing on with these caregiving activities. So a large body of research exploring the areas of concern for patients with complex care needs and their caregivers has spurred increasing recognition of these issues and indicates a critical need to improve the delivery of health services for these populations. So this brings us to our current study. So originally, the objective of this study was to identify and explore the research priorities of children and youth and older adults with complex care needs, as well as their caregivers, to better direct future research toward these priorities. However, the research team faced unforeseen recruitment challenges during COVID-19 lockdowns and was only able to include caregivers in this study rather than patients themselves. This study aim to identify participants' research priorities also shifted, as interviews revealed that instead of research priorities, participants focused more on service gaps and recommendations for concrete change. So as a result, the current study explored the health service delivery priorities of individuals with complex care needs in New Brunswick, with the aim to provide recommendations for policymakers and legislators for improving health service delivery for individuals with complex care needs. And with that, I will shift it over to Dr. McNeil.
Great. So I'm just going to turn off my camera just because my Zoom is being very glitchy. If you can't hear me, please let me know. All right, so for the study, we used a cross-sectional qualitative descriptive design to explore these health service delivery priorities for caregivers of children and youth with complex care needs and older adults with complex care needs for improving health service delivery. Data was collected using focus groups, semi-structured interviews, and self-report surveys. And we analyzed data using qualitative content analysis. We collected data from 37 caregivers of children and youth and 35 caregivers of older adults. And here on the screen, we just have a snapshot of some demographic information. Interestingly, or I guess not surprisingly, 95% of caregivers of children and youth were female, and 75% of caregivers of older adults were female. So moving on to these priority areas, or these top 5 priorities. First, we're going to focus on children and youth. So the priorities for caring for children and youth with complex care needs in New Brunswick. Many participants in our study expressed concern over the lack of access to appropriate healthcare supports and resources for their children and youth. They explained that they could not access the appropriate level of services, and this was particularly related to allied health and mental health professionals. Barriers included needing a specific diagnosis for referrals to services and long wait lists for services. And that was particularly for things like early interventions, and those long wait lists ended up rendering them not so early of an intervention. Participants also perceived a lack of care continuity and coordination as a substantial barrier to maintaining adequate care for children and youth with complex care needs. For example, participants described a need for more centralized care to bring together different providers and to educate caregivers on available services. And that really kind of speaks to the fact that New Brunswick does not have kind of that central location, such as a children's hospital, for those providers to kind of come together and provide care. In addition to obstacles within the healthcare system, many participants discussed barriers to full participation in school and daycare systems, and a lot of these barriers were related to their child or youth's complex care needs. Next, participants mentioned specific issues regarding the transition from pediatric to adult care for their child or youth with complex care needs. And this involved things like gaps in care and moving from a pediatric physician trying to get an adult physician, those kind of discontinuity in care. Finally, caregivers of children and youth in the current study said that they received inadequate support for themselves as caregivers. So moving on to our other population of interest, older adults with complex care needs. Participants described several concerns about the care of older adults related to accessing primary and specialized healthcare services. Many participants voiced concerns about having to rely on places like walk-in clinics while trying to find or replace primary care providers, usually that have retired. Participants also described frustrations with very long wait times for consultation with a specialist or receiving medical tests. So again, that kind of goes back to not having that primary care home. Participants expressed a need for assistance in navigating the diverse aspects of care required to address the multiple health and social care needs of this population. So again, needing more care navigation and coordination. Many participants mentioned issues with home care services in New Brunswick. These included unreliable availability of services, as well as their high cost and poor quality, or perceived poor quality. As mentioned, this data collection took place during the COVID-19 pandemic, or I guess during lockdowns, still around. Several concerns were identified by participants surrounding access to care and supporting an older adult with complex care needs while restrictions were in place during the COVID-19 pandemic. And this included things like staff shortages, needing to use virtual care, and not having the ability to accompany their loved ones to appointments. Finally, participants explained that caring for an older adult with complex care needs can be emotionally and physically draining, particularly where that affordable respite care is seldom available or hard to access. Participants expressed frustration with financial assistance programs that fail to consider the high expenses associated with caregiving. So overall, the current study highlights that multifaceted nature of caring for children and youth and older adults with complex care needs in New Brunswick. Future efforts should focus on things like refining and integrating, implementing integrated care models, improving that coordination of care, and developing interventions to support these two populations. The identified priorities, we hope, will provide direction for future provincial or national health research projects that are based on the most salient needs of these populations. So our findings do paint that increasingly familiar picture of patients and caregivers receiving inadequate care and support. But by centralizing these calls for change, this study may provide a new basis for closer collaboration with decision makers and in turn, get some movement toward more systemic change. Thank you very much.